It's Monday, April 11th, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to take a look at a study that was published in 2004, and it's entitled Ozone Therapy on Cerebral Blood Flow, a Preliminary Report. So let's jump in and take a look at what they have to say here. First of all, cerebral low perfusion syndromes have significant clinical and social repercussions. Of course they do. So how does ozone therapy help? Ozone therapy is a non-conventional therapy that has been used for several years in the treatment of ischemic disorders, particularly of the lower limbs. However, to date, very few studies have systematically evaluated blood flow changes resulting from ozone therapy. So that's what they're going to do here, is evaluate how ozone can actually help change blood flow properties, as I've talked about before with numerous people. So how did they do this particular treatment? Well, it's interesting actually, because they did, because of just some of their scheduling issues, they only did 3 treatments. They did it over 1 week. But they did 200 mLs of blood, so really a lot. They did quite a bit of quite a high dose here, and they put 200 mLs of ozone at 60 micrograms per milliliter into that blood. So it was quite a bit. What you'll note in these graphs and charts is you'll see here wherever there's an asterisk, that means there's a significant difference indicated. So here you have your baseline pre-treatment, and then you have your increase after the treatment was done, and then post 3, meaning post those 3 treatments, and then 1 week after that. So they wanted to measure and see, okay, is what we saw right after the 3rd treatment still viable after a week? And that's not a long period of time, but they showed that, yes, it is. So what did they see? Well, they saw it resulted in better oxygenation in tissues with poor blood supply. These rheological and vascular effects suggest that coadjuvant ozone therapy could decrease the vasoconstriction that is secondary to hyperoxia. In appropriate concentrations, this can upregulate the synthesis of antioxidants in blood. These properties have been very actively investigated with respect to the protection against free radical damage associated with heart, kidney, and liver disorders. Okay, so those are 3 huge areas where ozone therapy could potentially have a significant effect. So the number of ozone therapy sessions, and this is where they mention the amount not being quite what they wanted, for Doppler evaluation was less than that considered necessary for a full-fledged ozone therapy, which usually lasts for several weeks or even months. So if we can draw those treatments out longer and we can do them more frequently, we may see better results. Its potential use as a complementary treatment in cerebral low perfusion syndromes warrants further clinical investigation. So the positive results that they saw caused them to say, hey, this is something we need to take a closer look at. This is something that potentially could really help in these ischemic areas, whether it has to do with the brain or the limbs. Well, that's it for 5 Minutes of Proof today. Thank you for being with us. We'll see you next week.